I'm Dr. Sarah McAlpine. I'm a family practitioner here at the Primary Care Clinic at Stewart Avenue here in Alamosa. Flu shots are important because influenza is a vaccine preventable disease. Sometimes patients do ask, why is it important? Because isn't it a common cold? And we'll talk about that a little bit more when we talk about misconceptions. But it's not. It's a serious illness that causes a lot of sickness and debility each year. Our latest data is from the 2017-2018 season, and at that time there was about 1 million hospitalizations from influenza and almost 80,000 deaths in the United States from influenza. Even if you're not hospitalized or die from the flu, it does make you very seriously ill, and most patients are off work for about a week or out of school for about a week, so that causes a lot of burden financially and otherwise to people. So some common misconceptions about influenza vaccination. The first really is, even what are we vaccinated against? Because people call flu lots of different things. Stomach flu, where you have nausea and vomiting, or even sometimes a common cold will be referred to as flu, which is not the same as influenza, which is what the vaccine prevents against. Which is usually a more serious illness that's going to keep you out of work longer. Another misconception is that you can get the flu from the flu shot, which is not true. The flu shot, the virus that's in it is killed, it's not alive, so it can't cause the flu. And then sometimes patients will think that they got sick because of it, but more likely they got sick because they've either already come in contact with the flu before they got the shot or had some other germs that they picked up at a doctor's office or otherwise. Most of the time you're just going to have a little bit of a sore arm, and sometimes you'll have a little bit of a fever if your immune system is really responding to the flu shot. So when should you get your flu shot? It takes about 4 to 6 weeks to build up full immunity after you get the influenza vaccination. So at a minimum, you want to do it a month or so before flu season. Our flu season here in the Valley usually around January, February, but in recent years when we've had some more severe flu going around, it's been earlier, even in December. So the recommendation is not to wait to get your flu shot, but as soon as it's available to go ahead and get it, which it is available now in most places. The other recommendation is that you don't need to wait for a specific formulation like high dose. You should get the flu shot as soon as it's available to you, so anytime after now. So where can you get the flu vaccination? Any of our outpatient clinics are able to give you influenza vaccination. Here at Stewart Avenue, our primary care office can do it. Pediatrics also does influenza vaccinations for the kids. And then our outlying clinics in Monte Vista, La Jara, and Antonito can also provide influenza vaccinations for you.